let's talk about something that affects millions of people, but we often don't really get it until it's way too late. Shingles. It's this painful reminder of a childhood illness that, honestly, most of us have probably forgotten all about.
So let me ask you something. Did you ever have chickenpox? I bet for most of you, it's just a fuzzy memory of itchy spots and maybe getting to miss a week of school. Well, here's the wild part. The virus that gave you chickenpox, it never actually left your body. It's been lying low, hiding inside your nerve cells this entire time.
Okay, so let's get into this. How on earth does a childhood illness come back to bite you decades later? Well, it all comes down to the virus itself. You see, shingles, which has the fancy name Herpes Zoster, isn't a totally new infection. It's literally the chickenpox virus, the varicella-zoster virus, waking up. After you got over the chickenpox, the virus basically retreated from your skin and set up camp in your nerve tissue. And there it sits, silent, for years, sometimes for decades. So think of the virus's journey in 3 steps. First, you get the initial chickenpox infection. Easy enough. Second, it goes into this super long hibernation phase, dormancy, hiding out in your nerve cells. And then, step 3, something triggers it to wake up. Often, it's a dip in your immunity. And when it reactivates, it travels back down that nerve path to the skin, and boom, that's what causes the shingles rash. And listen, this is not some rare freak occurrence. We're talking about a 1 in 3 chance that you'll get shingles in your lifetime. Think about that. In Australia, for example, over 95% of adults have had chickenpox. That means pretty much the entire adult population is carrying this sleeping virus and could be at risk. It's staggering. So what does a shingles outbreak actually feel like? Let me tell you, it is so much more than just a simple rash. The whole thing follows a pretty clear timeline. And what's weird is, the first sign usually isn't the rash. For a few days, you might feel this strange, localized pain on one side of your body. People describe it as burning or stabbing. That's called the prodromal phase. Then, the painful rash with all the blisters shows up. Over the next week or so, those blisters crust over, and the whole thing usually clears up in about a month. Now, here's one of the biggest telltale signs of shingles. The rash is almost always on one side of the body. It's unilateral. That happens because the virus wakes up in a single nerve root, and it just follows that one nerve's pathway. It creates this very distinct strip of blisters that you'll notice doesn't cross the middle of your body. Now, for a lot of people, the rash heals up, and that's the end of the story. But, and this is a really big but, for a lot of people, the pain doesn't go away with the rash. And this is where shingles can turn into a serious long-term problem. The most common complication has a mouthful of a name: post-herpetic neuralgia, or just PHN. This is a persistent nerve pain that can stick around for months, or in some cases, even years after the blisters are gone. And we're not talking about a little ache here. This can be severe, sharp, debilitating pain that can really change your life. And the risk of developing this chronic pain isn't the same for everybody. Age is by far the single biggest factor. The risk just skyrockets as you get older. In fact, for people over 80 who get shingles, there's a 30% chance they'll end up with this awful persistent pain. That's huge. And the complications don't even stop with the pain. Depending on which nerve the virus decides to wake up in, it can cause some really serious problems. If it hits the nerve near your eye, it can lead to vision loss. If it affects the facial nerve near your ear, you can get something called Ramsay-Hunt syndrome, which can cause hearing issues and even facial paralysis. Okay, so after hearing all that, the obvious question is, what can you actually do about it? Well, the good news is, there is a very effective way to keep this virus from ever waking up in the first place. It really all boils down to one word: vaccination. Getting vaccinated is the single best thing you can do to prevent a shingles outbreak and, just as important, to dramatically lower your risk of getting those awful complications like PHN. In Australia, there are 2 main shields, if you will, available to protect you from this virus. One is called Shingrix, and the other is Zostavax. Both of them are designed to basically remind your immune system about the chickenpox virus to keep it locked down and dormant. But they are not the same. Zostavax is a live vaccine, meaning it uses a weakened form of the actual virus. Shingrix, on the other hand, is a non-live vaccine, and it's been shown to be much more effective, especially for older adults. Because it works so well, as of November 2023, Shingrix is now the vaccine that's funded under Australia's National Immunisation Program, the NIP.
So, who exactly should be rolling up their sleeve for this vaccine? Let's break down the current recommendations in Australia. The most important thing for you to know is that for people who are considered to be at the highest risk, the better vaccine, Shingrix, is available for free through the NIP. This program is all about protecting the most vulnerable people in the community.
So who's eligible? Well, first up, it's mainly based on age. The program covers all people who are 65 years and older, and it also includes all First Nations peoples who are aged 50 and over. But it also extends to another really high-risk group, immunocompromised people who are 18 and older. This means folks with specific conditions, like those who've had an organ transplant or have certain blood cancers or advanced HIV. And because Shingrix is a non-live vaccine, it's actually safe for people with weakened immune systems, which is a huge deal. So look, the number one takeaway here is to just have a conversation. The absolute best thing you can do is talk to your doctor. They can look at your personal risk, they can confirm if you're eligible for the free vaccine, and they can help you figure out if it's the right move for you. And that really brings us to the final thought. For most of us, the virus that causes all this trouble is already inside, just waiting. So the only question left is your shield ready to keep it there?